This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
It is one of the deadliest cancers in the world today. For every 100 people to be diagnosed with liver cancer, 95 of them will likely die due to the disease.
It has an incidence of something like 6,000 to 8,000 cases per year. And it is very fatal in the sense that almost all of them die within 6 to 8 months.
According to the International Agency for Research on Cancer, liver cancer is now the third leading cause of cancer deaths in the Philippines, with 20 deaths recorded daily.
Liver cancer is a type of malignancy in the liver. It has two kinds. One, the primary liver cancer. And then the other kind of liver cancer is called metastatic liver cancer. This is the cancer that spreads to the liver from other organs.
Most liver cancer cases are fatal, since it is often diagnosed at an advanced stage. It can usually be traced to infection from the hepatitis B virus, with symptoms such as fatigue, loss of weight and appetite, discoloration of the eyes, vomiting, and many others.
If ever they will develop symptoms, the most common is weight loss, followed by right upper abdominal discomfort, and then a palpable mass in the right upper abdomen or in the epigastric area, which is the middle portion of the upper abdomen. So those are the manifestations.
Other known risk factors include cirrhosis, or the formation of scar tissue in the liver, diabetes, obesity, and non-alcoholic liver disease.
Patient will develop a chronic liver disease, whatever the cause, and in the Philippines, the most common is chronic Hep B. The other chronic liver diseases that can lead ultimately to liver cancer are hepatitis C, fatty liver, alcoholic liver disease, and those metabolic liver disease that are not treated and subsequently develop liver cancer.
But liver cancer is highly preventable.
You should know the limits when it comes to alcohol drinking. Number two, as I mentioned, you have to avoid too much of oily and fatty foods. Develop the habit of exercising even just 3 times a week, especially if you're gaining weight, to prevent fatty liver. And then number 3, if you are exposed to patients or individuals who are at risk of hepatitis B, you have to be vaccinated. And number 4, of course, you have to check even just one every year or every 3 years, your liver function test and ultrasound.
What are the different types of liver cancer? What are some other health complications associated with this fatal disease? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Vanessa De Villa, a liver surgeon and head of the Liver Center of the Medical City. She also headed the first liver transplant operation at the Medical City. Also joining us tonight is Dr. Marie Cherilyn Samson Fernando, the chairman of the section of Medical Oncology of the Manila Doctors Hospital. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening. Good evening.
September is Liver Cancer Awareness Month. And before we get into understanding and learning more about liver cancer, let's first educate us first on the function of our liver. Dr. De Villa, let's start with you.
Okay. The liver is the largest solid organ of the body. it's about 2% of one's body weight. So if you're a 60 kilogrammer, it will weigh about 1.2 kilograms, roughly. So the liver has many functions. It's a gland. It's a very big gland. Number one, it's a factory. It produces substances, proteins that the body needs for metabolism, like albumin, clotting factors, help in clotting blood. It detoxifies. It helps detoxify blood from harmful substances like alcohol, drugs. It produces bile as well, and bile is important in digestion of food, especially fat, breaking it down to substances that can be easily absorbed by the body. It's also a storage organ, for simple sugars, vitamins, and iron that can be used when the body needs them. And it also is important in the breakdown of ammonia into urea, which is important, again, in the metabolism of the body.
So many different functions of our liver.
Yes.
I didn't realize that it had all these functions, and maybe because we don't see it, you don't notice it, but it does so many wonderful things to our body to keep us healthy.
Yes.
And when we neglect our liver, it causes so many different types of illnesses, and one of the biggest illness or disease that the liver can have is liver cancer.
That's correct. Yes.
So what causes liver cancer? Now we know the function of our liver. What causes liver cancer?
There are a lot of causes, but most common is if you have chronic hepatitis B or chronic hepatitis C, chronic alcohol ingestion or heavy alcohol intake, if you have fatty liver, and other causes would be aflatoxins that you found in those that are in peanuts, in corns that were not properly stored. Caused by a fungal Aspergillus flavus, something like that.
And these that you've mentioned are not genetic in any form. They are acquired.
It can be passed from a mother to a child if the mother has hepatitis B.
Okay, and briefly, how does one contact hepatitis B again and see?
So hepatitis B, you can get it from blood transfusions, primarily hepatitis C from infected needles.
And the alcohol, you mentioned alcohol abuse as well.
Yes. A heavy alcohol drinker is defined as an intake of alcohol of about 40 to 60 grams a day. And one simple drink is about 14 grams. So for females, they said about 3 drinks, 2 to 3, and for males about more, 3 to 4, something like that.
This is daily.
Yes.
Your daily alcohol intake will indeed take a toll on your liver. What happens to the liver? Let's take, for example, a heavy drinker. What happens to the liver? Does the liver have to work double time to be able to absorb the alcohol or excrete or eliminate the alcohol? Dr. Devilla?
Yes, alcohol is toxic to the liver. So if you drink too much, it can destroy the liver. So the liver is destroyed when there's an insult of whatever form, no? Maybe viral hepatitis, which is the most common here in the Philippines, hepatitis B especially, and then alcohol, as we mentioned. Fatty liver can also eventually lead to cirrhosis. So when the liver gets damaged, it's usually a slow kind of damage, hindi biglaan, although you can also have acute liver failure. But this type of damage we're talking about that predisposes to cancer is a slow damage that leads to fibrosis or scarring of the liver and eventually becomes cirrhosis. So a cirrhotic liver is one big scarred liver. So it becomes fibrotic, hard, and in that environment of abnormal cells and abnormal growth, that environment favors the growth of cancer. So that's what happens.
Okay, so you've mentioned cirrhosis is one form of the cancer.
No, it can cause the liver
cirrhosis.
cancer.
It can cause liver cancer. There are other factors that can cause liver cancer aside from cirrhosis. Would you like to mention?
Yes, we've mentioned it already, no? Too much fat can cause liver cancer, your hepatitis. But primarily it's caused by the chronic hepatitis B or C, because they can lead to cirrhosis of the liver. And that cirrhosis can damage your liver and eventually make you at risk for developing lung cancer.
Once one has been diagnosed or with liver cancer, how does the body function after being diagnosed with liver cancer? Dr. Deville?
Oh, normally, unless you have a screening program where you detect them early, the most usual thing is that you detect them late, you know?
Why is that? Why is it always detected at a later stage?
Yes, because the liver is big, it's a huge solid organ. So if the cancer is in the middle, you don't really feel it. But if it's like at the edge or it protrudes already, it's growing so big that it protrudes, then that's the time you begin to feel something. So it's very common here, especially in our country or maybe even in Asia, that when the symptoms start to appear, the cancer is usually at a rather advanced stage. Now, when people screen, when there are people who know their risk factors and they screen, or the doctors suggest or recommend screening or screen their patients, then the cancer is detected at an early stage when they are still small. And this is preferable because this is when we can still do something, when we can still treat the cancer.
So when you know that you're predisposed to liver cancer, then all the more you should be more vigilant and you should go for screening.
Yes,
how often should the individual do screening once they know that they're predisposed to liver cancer?
It depends. If you're cirrhotic, you can do liver ultrasound combined with a blood test like an alpha-fetoprotein every 6 months.
So cirrhotic meaning you're prone?
Scarred.
You have cirrhosis.
You have cirrhosis.
Cirrhosis, okay.
Scarred fibrosis of the liver with nodules. Depends on
Like
the degree of
what we saw on
cirrhosis.
the video, no? So there are people who are more prone to cirrhosis and there are others who have a different cause for liver cancer. Isn't that correct?
Yes.
Yes.
It has been found now that patients with chronic hepatitis B, sometimes even if they do not have cirrhosis yet, but they have a long-standing infection already, they may develop this. And diabetes is now associated with development of liver cancer as well. We may see them even when they are not yet really, they do not have full-blown cirrhosis yet, but they may already have some fibrosis or scarring, parang may tama na yung liver. And then it's also associated with metabolic syndrome. These are the things that we see now associated with liver cancer.
You mentioned, before we cut to a break, you mentioned may tama na yung liver. So, on the outside, hindi naman mapapansin kung may tama na yung liver. It's upon consultation with a doctor, no? Briefly, the signs or the symptoms that will manifest once your liver is already scarred or damaged.
It depends actually. Initially, you don't have any symptoms, but later you can have abdominal pain, you can have weight loss, you don't feel like eating. At later stages, you can have ascites, meaning you have fluid in the abdomen, or you can be jaundiced, naninilaw at the later stage.
Okay. Doctors will talk more about liver cancer. We'll talk more about the symptoms. We'll talk about the treatment and diagnosis. All that and more when MedTalk returns.
Based on recent estimates made by the International Agency for Research on Cancer for the Philippines of the World Health Organization, liver cancer is the second leading cause of cancer deaths among men in the country and fifth among women. Worldwide, infection from the hepatitis B virus accounts to 53% of primary liver cancer cases.
We're back here on MedTalk, still talking about liver cancer. Before we got to the break, doctors, we were talking about the symptoms of liver cancer. You mentioned loss of appetite. Is this even without loss of appetite or losing weight, even without trying?
Yes, it's like that. So patients normally complain of bloatedness, bloating, that they could not really explain, and then easy fatigue, they get tired easily, loss of appetite, as you said, and then their skin color changes. Eventually, they also develop yellowing of the eyes. and then non-specific abdominal pain, especially in the upper abdomen. They also somehow present with the symptoms of cirrhosis, because many times they also don't know they have cirrhosis, and on top of that cirrhosis, they have cancer. When they have abdominal enlargement already due to fluid or edema, worse symptom, then it's usually already advanced stage.
How long should these symptoms last? How long should you feel them before you consult your doctor?
Actually, it depends on the person. Some will be, even without symptoms, they really go to a doctor. Sometimes in the late stages that it has spread already to the other organs or to the bones or to the lungs. That's late stage already. So for people, we recommend, especially those with cirrhosis, they should consult for screening already. Like they can do a liver ultrasound, or they can do blood exams to see if their liver is functioning, like an SGPT like that, or an alpha-fetoprotein, which are tumor markers that are common for liver cancers.
Okay, doctors, we have a caller on the line. We have Jay Salcedo. Good evening, Jay.
Yes, good evening.
Yung question mo for our doctors, please go ahead.
Yes, ma'am. Kasi I was diagnosed previously dengue. And nung nasalinan po ako ng platelets, bigla po akong nanilaw. And then, nakita naman nila na negative po ako sa Hepa B. Pero yun nga, nakita nila na fatty liver. Is there any high risk for magkaroon ng liver cancer pag ganun?
Thank you, Jay. Yes, let's start. Dr.
Yes,
Fernando.
if you are obese, if you have fatty liver, you have diabetes, yes, you are prone to liver cancer. And for his case, he also had blood transfusion. But, you know, it takes decades to have liver cancer, no? So
it takes decades. So what do you suggest that Jay would do at the moment? Preventive? Is there any measure that he can do?
From the dengue, no? So yeah, I would suggest he consult a liver specialist or a gastroenterologist and have his liver function tested.
Okay, Jay.
Maybe you can also have an ultrasound again.
All right, thanks.
Okay, you're welcome.
Thank
you for calling. Doctors who are prone to liver cancer, aside from those we've mentioned earlier, are there other types of individuals who are more prone than others? Dr. Devilla.
Well, as we said, we're talking about primary liver cancer here, right? That it originates from the liver. Basically, those who are prone are those who have chronic hepatitis B. And again, we go back to those who have cirrhosis. All people who have cirrhosis of any cause are those who are most prone to liver cancer. And then the diabetics, but not all of them. And then people who have fatty liver and what we call the metabolic syndrome. Yung hypertensive, obese, it's a conglomerate of symptoms that usually also lead to some damage in the liver.
We can't, we have to keep reminding everyone of these symptoms, these factors, no? Because we want them to remember all of these things and to be more mindful of how their body functions or if their body's not functioning well. Isn't that right, doctor?
Right, so if they have, some risk factors, they can be more vigilant and have themselves tested sooner.
And during these tests, what happens during these tests, Dr.
To diagnose, you can do a CT scan or an MRI or just an ultrasound, and then you can do a biopsy of the liver. If, for example, the scans are not definite, but you have a mass, we can do a liver biopsy.
And by doing the liver biopsy, just in case it has a positive result that one has liver cancer, so how do we move on from there?
So you have to know first if the mass is still resectable, meaning can they remove it? Is it an early stage that you can have an operation or a liver transplant or a radiofrequency ablation? It depends. So if you have detected the mass, you also check other organs if it has metastasized already, na kung kumalat na siya.
Okay, so minsan ang cancer lang of the liver is just concentrated in the area, in the liver only. Tapos
No.
minsan nagkakalat din
Yeah.
siya to the other
The
organs.
definition of cancer is it can invade other organs. So it can spread to the organs beside the liver, or it can spread to the lymph nodes, and it could spread to parts away from the liver. Like it can spread to the bone or to the lungs, to other organs.
And how does this cancer grow? How does the individual sadly make that cancer grow inside their body? How does that happen? Dr. De Villa?
Well, it just grows, no, as time goes by. Of course, it starts with maybe a single cell, then divides, and then the tumor just gets bigger and bigger, you know, over time. Some perhaps grow at a faster rate than others. This is because they receive blood supply from the liver as well. No? Blood vessels that go to the liver, some of them go specifically to the tumor, and that's how they are nourished and they grow. No? So it is good to detect them early, but as we said many times, they manifest late. But when they appear, then that's the time we assess if they can be removed, because the best treatment is still surgical, because you remove the tumor in as far as it is possible to do that. That's when we get called to assess.
Okay.
And then if not, then there are other treatments that we can apply locally to the tumor. And you can even do what we call loco-regional treatment, applying treatment through the vessels that go to the tumor.
So you've mentioned the treatments. How about before that, the stages of the different stages of liver cancer? We catch it at an early stage, and there's a corresponding treatment for that as well. What corresponding treatment is given or is available?
The stage will depend on the size of the nodules. If there's fluid already in the abdomen, if there are nodes that are involved, if there's the condition of the liver, if the liver function is still normal. So basically, it's an early or an advanced stage. No? So it depends on the atomic size, the liver function. That's it. So if in early, doctor has mentioned that they can do surgery, liver transplantation, or what we ablation treatments, and in late you can do a lot of things. No, though chemotherapy now it only works 10% of the time. No, so there are now targeted therapies like sorafenib that would control the growth of the tumor, but still the results are not yet as good. Okay, just a few months in your life, in your survival. So the best really is to prevent the liver cancer.
Okay, so if the cancer is caught at an early stage and a portion of the liver is taken out, will the liver regenerate?
Yes, certainly. That's a good thing about the liver. No, it can regenerate. In fact, you can remove as much as 70% of a normal liver, and the remaining portion will still be enough for the person, and it can grow again. It can regenerate, provided it has the corresponding blood vessels and ducts that remaining portion needs. No?
Okay, doctors, we have a Facebook question this time.
Okay.
A member of my family has liver cancer. Am I at an increased risk of getting it myself?
Yes, usually when one in the family has it, then the rest of the family members are at risk, and they have to be tested. So the first thing to do is to figure out the risk factors in this particular family. Maybe for starters, get the hepatitis profile of these family members. The one who is affected, and then the rest of the family as well.
Even if the family members have different lifestyles, maybe one may be into drinking and the other has hepatitis, does that affect like our Facebook question?
Yes, in general, no. Household contacts, family members should also be tested.
Okay, all right, doctors, we'll talk more about liver cancer when MedTalk returns. back here on MedTalk, still talking about liver cancer. You may join the discussion by calling our hotline at 548-4678. Doctors, we have another caller on the line, June Gonyo. Good evening, June.
Hello, good evening, Doktora. Opo. Tatanong ko lang po kung what are the manifestations of a person suffering from fatty liver?
What's the manifestation? What do they feel? Sometimes they are symptomatic. You don't feel anything. But we can see fatty liver is very prone for patients who are obese, very common also in diabetics.
Diabetes. What else, Doktora?
Okay. Ano pa, Doktora, are the other manifestations?
For fatty liver?
For fatty liver, ano, June? Is that tama?
Yes, Mama po.
For fatty liver.
Usually, wala ngang manifestation is ang fatty liver. You detect it on ultrasound. So, it's very common here in the Philippines, happens to be. So, when they get an ultrasound for whatever reason or another, then they're diagnosed with fatty liver. So, if it's only mild, moderate, maybe you don't feel anything. But if it's severe, then there's some heaviness associated with it. As Dr. said, it's seen in people who are diabetic, those who have insulin resistance, overweight, obese people. Those are the ones who have fatty liver. No?
June?
Okay na
Yes,
ba?
Mama po.
Okay na yung answer ng ating mga doktora?
Okay lang, opo. Thank you po.
Okay, you're welcome. Salamat din.
Thank you po.
Okay. We always have to remind them of you don't have to have the symptoms for
Yes,
you
initially, you don't feel anything.
And more especially when you're predisposed to the cancer, no? That's the time you should be more vigilant in taking good care of your body and watching out for unusual signs or symptoms
Because
that may
fatty
happen.
liver can be just fat or fat plus inflammation. That's the more dangerous thing. They call it NASH, no? Non-alcoholic steatohepatitis. When you have fat plus some inflammation, this is the condition that can predispose to scarring and ongoing insult to the liver that may eventually lead to cirrhosis. So there are people whose cirrhosis we do not know the cause of. So many times they are what we call burnout NASH, or a fatty liver that has led eventually to cirrhosis.
So prevention is indeed key.
Lifestyle, diet, exercise.
All of these things that we should always keep in mind and that we should always remind everyone of. Doctors, prevention. Let's talk about prevention so that you know we may be more aware of do we avoid? How can we avoid liver cancer? For scarring of the liver.
For those people who are health workers who are exposed to blood, they should at least have a vaccination with anti-hepatitis B. And then also, you protect yourselves when you're handling blood. For example, hepatitis C is caused by infected needles. So be careful when handling needles. And then for fatty liver, of course, you start dieting now, avoid fatty foods, and exercise. And avoid drinking, because majority of your liver cancers are caused by alcohol intake.
Occasional drinking is fine.
Okay. Yeah.
It's okay.
Occasional is fine, but not heavy drinking.
Okay. All right. There's a difference. There really is a difference between heavy drinking and occasional drinking. And once that you have acquired that habit of heavy drinking, then it can lead to liver cancer and cirrhosis and then liver cancer. There are treatment options available. There is a cure. There is a remedy for that, Dr. Devilla.
Yes, certainly. So when we detect cancer, the treatment will depend on the extent of the tumor in terms of size, number, and location. So that's when we get asked to assess whether you can remove a portion of the liver that has a tumor to aim for cure. You can remove it entirely, no? Sometimes it's quite extensive and the liver is cirrhotic, then that's when we think of liver transplantation. Okay. But it can be applied to tumors within certain criteria that we call, no? Criteria of liver transplantation for liver cancer, based mainly on size and number, the tumor burden. So if there's any cancer that can be treated with transplantation, it's liver cancer. Now, if you detect them early, maybe you do not even have to operate. There are treatments that can be applied locally to the tumor, local ablation. One of them is RFA, radiofrequency ablation, that uses heat delivered through a special probe into the liver, into the tumor, and you burn it. You literally cook the tumor or kill it with heat. You can also do chemical ablation by injecting alcohol. That's when they are small. But when they are already big, or when they can no longer be resected, removed through surgery, that's when we apply treatments through the vessels that go to the tumor, or loco-regional treatment through the arteries. No? We have treatments like TACE, or trans-arterial chemoembolization, or SIRT, selective internal radiation therapy. With TACE, the procedure it's not a big operation. You just puncture the groin, access a blood vessel, and thread a catheter that goes to the liver. And once it's in place, you inject chemotherapeutic agent. Now for SIRT, what we inject are radioactive beads that are deposited into the liver, directly into the tumor, and sort of emit local radiation to try to shrink the tumor and prevent it from growing. So these things can be done now.
And these treatment options that are available, or that you've mentioned, are done here in the country?
Yes, they are available in the country
They
already.
are available in the country. Any other advice you'd like to share with all our viewers? We've mentioned lifestyle. We've mentioned not to drink too much.
Correct.
You know, we've mentioned exercise. What other tips or advice would you like to share with all of them? Let's start with you, Dr. Fernando.
Number one, you avoid smoking, you avoid drinking, you live a healthy lifestyle. You try not to prevent only liver cancer, but all the cancers, because most of them are preventable. If you are at risk, if you try to have your vaccination, you have to be screened. You have to be aware that even if you're asymptomatic, you don't feel anything, you can have liver cancer.
Dr. De Villa?
Well, basically, take care of your liver, live a healthy lifestyle, avoid anything that may injure your liver, and probably test yourself for hepatitis B, because the country is endemic for hepatitis B. So for starters, you may want to know if you have Hep B or not. Check for the antibody as well, because if you don't have the antibody, you've never been exposed, then you're a candidate for vaccination or immunization. And we strongly encourage that to help the liver. But in general, healthy lifestyle, you know, diet, exercise, and avoid anything that may injure the liver.
Lastly, it's Liver Cancer Awareness Week. Any support groups that are, month rather, that are happening this month that you would like to share with all of us?
For those who are interested to attend cancer, we have a cancer convention. The Philippine Society of Medical Oncology will have a convention next month. So we will not be only tackling liver, but all the malignancies as well. So those who are interested, they can attend.
Okay, so thank you very much, Dr. Fernando and Dr. De Villa. Thank you very much for educating all of us on liver cancer.
Thank you also.
All right, when we come back, get to know more options on preparing for and treating a serious disease such as liver cancer. All these and more when MedTalk returns.
According to the World Cancer Report of the World Health Organization, liver cancer is more common in low-income countries in Asia, Africa, and Central and South America. In these cases, the cancer is normally diagnosed at an advanced stage with limited treatment options in less developed countries.
We're back here on MedTalk, still talking about liver cancer. This time we have with us Dr. Mayda Jimenez Conda. She's the Assistant Vice President of the Providers Network Management of Fortune Care. Also with us is Dr. Gerard Perlas, Head of the Digestive Endoscopy Section of the MCU Hospital and the Medical Director of the Perlas Polyclinic. Today, they both have something to share with us in our fight against liver cancer. Good evening, doctors. Welcome to the show.
Good evening, Angel.
Dr. Perlas, how intensive is the treatment for liver cancer?
The treatment of liver cancer is highly intensive. It entails a lot of cost, no? Unfortunately. First of all, regarding the diagnostic procedures, you need to do, aside from the ultrasound, you need a CT scan and MRI. For starters, these are quite expensive tests. Then the next one, your doctor would have to classify the stage of your disease, no? Whether it is localized resectable, meaning it's still you could still do surgery for this type of patients. If it is the second one, if it is localized unresectable, no, unfortunately surgery cannot be done to these patients, no, but you could do ablation treatment as mentioned by our earlier speakers. And for advanced cases, no, of course, surgery is also not recommended, but palliative treatment, no, meaning being able to give the best supportive care to your patient is of utmost importance.
So, and in giving the best supportive care, you know, this entails, you've mentioned it's expensive. It can get expensive. It can be a burden also and can add stress to the patient. So is this covered by the HMO?
Well, for HMOs in general, they have coverages for dreaded diseases such as liver cancer. Now, in the case of Fortune Care, because I'm a representative also for Fortune Care, we do cover this, okay? We do have provisions that carries an aggregate limit for dreaded disease like liver cancer, and this would depend on the premium or on the contract availed by the member.
Is there a maximum time frame or length that the member can avail of this?
Actually, by standards, we do have what we call the contestability period, wherein during the first year of membership, pre-existing diseases such as liver cancer, as in this case, will not be covered, okay, ideally. That is by standards. But there are also contracts, or there are also accounts wherein this contestability period or the non-coverages for pre-existing disease is waived. So in that case, they do have coverages for availments related to this.
Is there a certain amount that they can extend or that they can avail of?
Well, it depends on the premium. It depends on the contract, okay? If it's stated there that the maximum benefit limit is 100,000, then that 100,000 can be used or can be maximized by the member for the treatment of the liver cancer.
Okay.
This would include hospitalization, consultation, any other laboratory workups related to it.
So that's the maximum amount that the
not necessarily 100,000, but it depends on the contract. Stipulated in the contract.
Okay, and can this contract be renewed, so to speak, so to avail of maybe a higher amount?
Yes, it can be renewed ideally every year. But I failed to mention earlier that although ideally for HMOs and for Fortune Care, it does have coverage for dreaded diseases like liver cancer, it will also depend if the etiology is part of the exclusion of the coverage. Say, for example, if liver cancer is secondary to alcoholism, like Dr. Perlas, no? So Dr. Perlas perhaps can give us a little background on alcoholism leading to liver cirrhosis and later on liver cancer, because ideally if the liver cancer is secondary to alcoholism, this is not really covered by HMOs.
Oh, okay.
Yes, alcohol is linked to the development of liver cirrhosis for several decades. Chronic alcohol intake, it's a long-term use, almost daily intake of more than 3 to 4 drinks a day of beer, no, it will lead to scarring or cirrhosis of the liver. Then after several years to decades, it will eventually lead to liver cancer.
Yes. So we've mentioned earlier hepatitis B and C and other factors that can lead to liver cancer. Is this included?
Yes, yes,
This one is included as well. Sometimes we tend to forget, or we tend to disregard all these factors and think that it will just be included, even if it's by our own volition, like taking alcohol every single day, right? So what other tips or what other factors should we remember when it comes to an HMO or availing of the maximum amount that we can, in order to alleviate the expenses that we have when we have, in this case, liver cancer?
Well, on the part of the HMO, the first thing that we usually advise our members is that when they enroll for a certain plan, they have to really understand the contract. So stipulated therein are the benefits. Okay, so this is just this will serve as a guide for them, to know what they can avail and what is not covered. So because if the need arises that, like, say for example, like dreaded diseases like liver CA, definitely they would need hospitalizations. But if from the very beginning they do not know that it is covered, then there's going to be inconvenience on the part of the member. So my main advice to our card holders is to really understand the contract.
Dr. Perlas?
Well, as far as prevention, it has mentioned vaccinate your family for hepatitis B, drink alcohol in moderation. But what was not mentioned was the prolonged intake of food supplements, and herbal drugs. These drugs may not be entirely safe. They may also injure the liver, especially taken for prolonged periods. So just an added caution to our viewers.
Because sometimes, we take all these supplements and the liver has to work double time to absorb all these supplements that we think is good for our body. But in the long run, nakakasama rin pala.
It's true.
Yes.
It's true.
And in your experience, doctors, when it comes to the HMO, and you mentioned to read the contract, read the fine print all the time. What's your what would you say is the common encounters with the members?
Well, we do have members that what they perceive of the HMO is that everything is covered.
Yes.
Okay.
Yes.
So when they need it already, and then when they tell them that, sorry mom, we only have a caps on this particular test. Say for example, your limit only covers you 10,000 for a particular diagnostic test. But the amount of the diagnostic test, like what Dr. Perles mentioned earlier, that is very expensive, especially the workups for liver cancer. So when we tell them that you have a limit of 10,000, then they get mad at us, okay? Because they do not know, they thought all the while that everything is covered.
Yes. Yes.
So those are some of the common encounters that we have with our members. So that is why we make it a point to really explain it to them so they would understand. So in the future, we will not have problems such as like that.
And not encountering problems like that, again, aside from reading the fine print, is there any website that they can visit? Is there any contact details that they can jot down while watching? Yes.
Well, actually, for Fortune Care, we do have our website. No? They can just Google it in the computer, and Fortune Care, www.fortunecare.com.ph. So all the information that they need for the company on how to apply, the providers that they would like to look for, everything is stated in there. So perhaps they can just visit our website and for further information.
Thank you, doctor. Last tip to our viewers in taking good care of their health?
Well, aside from avoiding what causes liver cancer, on the part of the HMO, perhaps I could advise our televiewers to be prepared. Okay, so getting sick is not really very cheap. It's very expensive, in fact. So you might want to consider getting health insurance. So this could also be your protection, perhaps, no, financially, in cases wherein you will have to need it.
Okay. Thank you very much, Dr. Ganda. Dr. Perlas.
So prevention is the key here, no? Because we know liver cancer is an ominous disease, no? It entails a lot of costs. So prevention cannot be overemphasized. As mentioned before, everything in moderation, alcohol, intake of fatty foods, adequate exercise, avoid unnecessary drugs, not recommended by your doctor.
So thank you very much once again, Dr. Perlas, Dr. Ganda.
Thank you.
Thank you.
Our pleasure.
See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9 TV. This is Angel Jacob. Take care, everyone. Good night.